worldwide. Low and middle income countries, this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable to physical inactivity. In health services. Strong leadership and urgent action are really leadership. The remarks by the Honorable Minister unveil important feature about this important initiative, but we look forward to learn this does not once again for this transformative initiative.
Thank you, Manuel. Ways. Of course, if you mention MTN, you must mention Telecel. They are also represented here as well. At this point, it's time to bring it a bit more home. When we talk about chronic diseases, many think that it is associated with just the aged, but nowadays more and more situation. I have in our midst this morning, ladies and gentlemen, it's time to Madam, any nature different any penny for you now more. Madam Wasi, Chiamu. Actually, me a diabetic patient. Emre bebre tremono. Yahunu say a penny for yare. Anani omu sika omudi srochi and omunya sa yare no. Ya yare a beti maba nkwala mu nsusu. Minya eno check akra ba me ema we kura enwu at nyame adom igusu metinase nti dia meka ne se sesia no ebia ba me ba nsusu amigusu a me solve but enye yare a ebeko intimi esum but ade kakra meka ne se ye dro no eya ne boarding me samato na mato amakola no so eye di mami at times de ebe di kura nyame na ebe mu nti me adis ready say ebe se o ma pani enya ho bua maye ma
aduro no ono so benya aduro ni bi e dia preventing no edanasi se MahamaCares na odi bae no edanasi bebre se nyame nhira so na adwempa ayamaye se ofa bi ewo mu maye no embremu medamwase.
I'll try to do a quick hoping that MahamaCares is here to stay. She highlights the situation she's faced with together with her daughter as a result of the sickness or the diabetes that they are having to live with. And they are hoping that there will be subsidies on medications for them and those living with that disease. Rather a touching story, but it's time to uplift ourselves because we know that there's a new era in chronic disease care, and that is in MahamaCares. At this point, we've come to the time where we finally have the presidential launch of the MahamaCares initiative, which is the Ghana Medical Trust Fund. I'll tell you something. Yesterday, a Jumara was launched. Today, MahamaCares is being launched. Tomorrow, the National Apprenticeship Program will be launched. That's not all. Relax. On Thursday, we'll have the Black Star Experience launched. At this time, you can do the round of applause. It is now my distinct honor to respect Dramani Mahama. Please, shall we rise and give him a thunderous applause as he comes to speak to Ghana.
Remarks by our sister here, very touching. And maybe I'll make a few remarks before I inflict the what the minister said, but I want to say I can empathize with what she's going through. It was a disease for the rich. Hypertension, cardiovascular diseases, diabetes were diseases of the rich, but increasingly we see that it's inflicting more the persons who are much poorer and can least afford to be able to manage those diseases. And that's why the Ghana Medical Trust Fund has come at the right time. I have a personal connection to non-communicable diseases, and that is because my father died, mother died, in 26 and diabetes. My stepmother died of breast cancer. I lost a friend, I'm sure most of you know, Mawena Dumont, whose son is in his 30s and is on dialysis, is suffering kidney failure. And so these are not things that are far away from us. These are things that are close to us. These are loved ones that we're talking about. And like prosciuttis, and we must not see them as statistics. We must see them as real lives that we need to touch and help. But there's the even sadder story of one of my confidants and strong supporters when I started this whole political journey. He was an assemblyman, and he was an executive of our party in Bole Bamboy, where I started my political career as a member of parliament. Very close to me, went everywhere with me. Anytime I went back to the constituency, he was in charge of the southern zone, and so anywhere I went, he went with me. And a few years back, he started to have a problem with his kidneys. And so at the time, there was no dialysis north of Kumasi. And so if you had kidney failure anywhere above Kumasi, you had to travel to Kumasi to do dialysis. And so he used to travel from Bole Bamboy like once every week to do dialysis, go back, and the cost was unbearable. I tried to help as much as I could. Eventually, he needed more, dialysis treatment, and so he couldn't be going and coming. So he had to move his whole family to stay in Kumasi, rent accommodation in Kumasi, so that he could be close to Konfano. Was becoming unbearable. Eventually, he died. And he died leaving poverty behind because he sold all his assets to be able to look after himself. And so we had to take care to support some of the children to be able to finish school and all that. These are real stories. And that is why what we're doing today is important, because it will touch a lot of lives and help a lot of our fellow citizens. But let me say that this program must be linked and will be linked to our primary health care volunteers and designated community pharmacies, where our citizens, wherever they, because like was said by the UNICEF director, these diseases are preventable. And even if, and so the primary health care would have community volunteers who will go from house to house occasionally, maybe every 3 months, every 6 months, and just take people's blood pressure, check their sugar level and all that. We'll have a program where women, are able to detect a linkage between MahamaCare and the primary health care program when we launch it. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents and your genes, but a far greater number are lifestyle diseases. They are acquired. They are not genetic. And so if people just know, of disease burden that we currently are seeing. I want to thank our brother from CalBank for this particular exercise. And I want to encourage corporate Ghana, businesses, the mines, the banks, and all the other fund program. Those is coming to help are your clients who save their money in your banks. They are your clients who do business with you. And indeed, they are not only your clients, they are even your own staff. Some of your staff have died, from breast cancers and diabetes and all that. And so, as part of your CSR, if you give anything, you are giving it not just to help people, but to help your own clients and your own your customers and your own staff. And so I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to assure Prof. Adanu that while he was speaking, I mean, the many suggestions he was throwing out, I turned quietly to the Minister of Health and asked, "Are you taking notes?" And he quickly took his paper and started writing. So, Prof, you can be sure that note has been taken of the suggestion you made, and we want to thank you for that. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical circles. And so when he gave the envelope, I mean, for a retired pensioned, medical professional, I was curious to see how much he had given. And I peeked at it. And he won't want me to mention it, but I want to say that I was surprised at how much is $1,000 to Ghana Medical Trust. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also the initiator of this laudable. I've pledged half a year, 6 months of my salary to MahamaCares. I'm not yet being paid. They say Accountant General is still doing. So I thank you very much. Now let me inflict my speech on you. Mercifully, it's short, so you won't have to live through too much pain. Yeah. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, MahamaCares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals and most healthy lives, and promote well-being for all at all ages. Specifically, under SDG 3, Target 3.4, commits the global community treatment and promotion of mental health and well-being. Across the globe, and mental health disorders remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty. They widen populations, that is, those with lower education, limited access to healthcare, lower income levels are currently most at risk, promoting social justice and securing environmental sustainability. Ghana, the picture is equally alarming. Available data indicates, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in 1,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic disease have economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Percent of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more scheme. It remains inadequate in fully covering NCD-related services and medications. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. The establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Consultations inputs from over 3 friend emeritus Professor Seth Aite submitted MU that their accompanying draft bill, as the minister said, end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming costs of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. Chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can, I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Prof. Seth Aite, and to extend my heartfelt gratitude to those who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare, is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right, Ghana Medical Trust Fund into brackets MahamaCares duly launched. May God richly bless all of us, and may God continue to bless our homeland, Ghana. Thank you very much.
Please, you can take your seat. But we've got $1,000. We have six months salary promised. We have, but with your permission, Your Excellency, do we have any takers, or you want to give in? On the quiet. Please, I want to get to the Well, so his boss has given 6 months of his salary. Thankfully, there are 3 ministers.
We also cannot go above the Minister for Health. And so, as
we have the Vice President's Chief of Staff here. We have the Deputy Chief of Staff outside. We have the Secretary to the President. And I see Corporate Ghana. I see CalBank. I see MTN. I see Telecel. I see NHIA boss. I see Ghana Health willing to also do it. You can do so. I see the rector, physicians and surgeons also here. So any takers, let's do this quickly. The president has to leave us. Any takers? Or I should see. Okay, I see a young lady. How much, please? Let me write. Who is taking notes? Thank you so much, Doc. I'm writing. Seydou Agongo, Alaji Seydou Agongo, is giving us 500,000 Ghana. Doc, are you taking notes? Otherwise, I'll take it away. Please, any other takers? Okay, Dr. Kaba.
So, on behalf of the Ghana Health Service, and of course, I cannot go beyond my boss. Together with the health insurance, we also pledge 1 month of ours.
1 month salary. Our boss, can they go beyond you? Your boss says you can go. Good. You are below, yes, you are below the ministers, below their boss, above MPs. Let's do what we do 1 month. Our development partners are here. Ask for them. You will come later. Okay. Wow.
Everyone. Yes, my salary is scanty, but I'm promising 2,000 Ghana cedis of my salary.
Your name,
Thank you.
I'm happy. Thank you so much. Scanty salary for 2,000. Yes, sir. Okay. 50,000. Their hands here, please. Hopefully, NHIA will pay you, so you pay us. Okay. Yes, sir. Allied professionals. Ole, okay. God bless you. Yes, ma'am. The nurses are on show. Yay. That this may not be a church. That God will see, but this one, we are following you. And take it by. Wow. Committee. Yes, sir. Thank you. Any more takers? Let's wrap it up. Yes, sir. Oh, I'm hoping to hear from MTN, Telecel, Cowbank. You are doing it on the quiet. As for I know that you there, you don't talk. All of you. Thank you so much. Two more. Then I will see you after and then take it. Please, sir. Mm-hmm. And then the very last one. $10,000. Okay, so at this point, we will be communicating platforms. Since we have our telcos here, they've made available platforms where you can contribute from the comfort of your home, wherever you are, you can contribute as well. But the copyright, we have more. No, you levy. Okay. Okay. Please, at this point, I'd like to welcome our hosts for today's event. At least he has given the center for us to be able to do this today. Please help me welcome the CEO of
in the spirit of giving. UGMC pledges, Your Excellency, the President of the Republic of Ghana, Honorable Ministers of State, Members of Parliament, Directors of the Ministry of Health, Management of UGMC, my own teacher and mentor, Reverend Professor Aite. Distinguished guests, ladies and gentlemen, of the official launch of the Ghana Medical Trust, our health professionals, and indeed all guidance for his visionary leadership to the health and well-being of every Ghanaian. We also extend our deepest appreciation to members led by Reverend Professor Aite, our honorable ministers, our partners, and every stakeholder who has worked tirelessly to bring this initiative to fruition with a that will benefit generations to come. Allied and all frontline workers, this fund is a recognition of your service, your challenges, and your value. May it bring improved support, facilities, and motivation as we continue to save lives. To our guests, dignitaries, and all attendees, thank you for honoring this event with your presence. Your participation signifies a shared commitment to a healthier Ghana. Finally, let us not see today as the end, but as the beginning, sustain and ensure the impact of the Ghana Medical Trust Fund. Once again, thank you all, and may God richly bless our nation, Ghana. Thank you.
And thank you so much for hosting us. At this point, we've come to the end of today's event. Of course, you can be part of it. It will be live on all government platforms. So please make sure that you follow it. At this point, we'll take quick photographs. It's time to make memory with His Excellency John Dramani Mahama. Your Excellency, with your permission, would like you to come up, and then the task force and the allied groups will join together with the Ministry of Health to take a quick photograph. Then, of course, we'll our distinguished guests, a few of us, members of the standby as well. Members of the Parliament Select Committee, please, it's your turn. Corporate Ghana Development Partners, please be on standby. Professor Adanu will join this one as well. And then Janet will also come up. MPs, members of Parliament Select Committee, Gender Minister can join us. Government Communications Minister can join us as well. Corporate Ghana Development Partners, please be on standby. Corporate Ghana, please join us. Development Partners, Corporate Ghana, please join us. Let's do this quickly so the president at this point. Okay. University of Ghana Medical Center,